What were the majority of cases that you were treating in the very beginning, and how's that evolved or changed over time?
Oh, so like the bread and butter, for want of a better term, in general psychiatry is anything and everything from depression, anxiety, through to bipolar disorder and schizophrenia, and some of the more severe kind of enduring mental disorders like psychotic type illnesses. Some specialties will get more in the way of dementia. I don't tend to see that very often in my current job. But then in the general hospital, you get acute confusion states, so deliriums that present. And then there's a whole subspecialty all dealing with addictions that I didn't do myself, but some people end up specializing in that.
Gotcha.
And so now my job as a consultant is a bit different. So the last 6 years I've been working within a crisis team. So the actual setting where I work is, I tend to go out and see people in their homes, or else they come up to see me, but we provide treatment at home instead of admitting them to hospital. And so it's a lot of people who are suicidal that I tend to deal with in my day-to-day work now. And some people might be psychotic, or they might be severely depressed. And for others, it might just be social circumstances and like more of a situational crisis because of social issues. And somebody's had a kind of reached crisis point with suicidal thoughts as a result of what's going on in their life elsewhere.
Wow.
So a whole variety.
Yeah, a lot of difficult situations, it really sounds like. We've been fortunate enough to host Dr. Chris Palmer on our show, and we talked to him and one of his patients, Brett Lloyd, who you're familiar with. And he just came out with his book, Brain Energy, which in the low carbohydrate space, all of us have been waiting for that book. But what an amazing job he did. And you know, even to the point of like hearing him read the book and how emotional he got as he was talking about some of the things he was talking about. And you know, even being familiar with this topic and his work, you really got a sense of how difficult it is for somebody in your position to like make a diagnosis. There's so many different ones to choose from. They all have different nuances, and then how to choose how you're going to help that person with these different drugs. Can you comment on the challenges there and what that was presenting for you?
Yeah, so I think there's a certain amount of kind of experience. So I think over time in psychiatry, you just develop a level of clinical experience where it can be quite easy to diagnose people, but equally every so often you'll come across somebody where you're not really sure which diagnosis to pin it down to, and there can be a lot of overlap between different diagnoses for sure. I think the longer I work and the more I look into underlying metabolic health issues and how they relate to mental health, and also with my functional medicine training, the more I question the validity of our diagnoses or the usefulness of them, because I think, unfortunately, there's a lot of stigma that comes with certain diagnoses, and there's actually a lot of overlap between different diagnoses and the sort of treatment approaches that we might take, whether it's talking treatments in psychology or whether it's pharmaceuticals. So the way my brain has come to think about things now is I look at the majority of mental disorders as having underlying deficits at a cellular level that, you know, and a lot in common amongst the different disorders that a diagnosis doesn't really capture or do any justice to. And I think I've heard Chris speak on 1 or 2 podcasts, and I think he's touched on it as well in terms of the importance of epigenetics. And I went through training thinking that if somebody had a family history, there was a huge amount of emphasis placed on a family history of bipolar disorder or schizophrenia, and almost conferring an inevitability in terms of the children developing those kinds of disorders, particularly if somebody is presenting in an acute mental health crisis. And now my way of thinking has just really changed on that. So I think environment is the bigger factor in everything. And part of that is obviously our lifestyle choices.
Yeah. Wow. So how were you able to come to those conclusions? I'm assuming that you only learned that, which is different than what you were taught and what you were trained in, because what you were giving people wasn't working. Was that the case?
Yes, I mean, I definitely see that standard treatments such as medications can be helpful. I definitely see them help people, particularly in the acute setting. So somebody with an acute psychotic episode or a really severe depression, I see treatments like medications or even ECT can be helpful for them. But equally, I see other people who don't respond very well to treatment, or they only respond partially. And I think Chris Palmer, if I'm right in saying, he tends to deal with the more treatment resistant cases. So that would be rehabilitation psychiatry in the UK, which is a field that I don't work in and I haven't previously. But there are some people who do develop really chronic symptoms to the extent that they can't even function independently, and they end up in supported accommodation or even long-term hospital care. So it's definitely true to say that the treatments don't work for everybody. But I don't know if that's where my interest came from. I think my interest just came purely from wanting to know the root cause of people's difficulties, and just being curious really about what could the underlying mechanisms be. And I trained with Dr. Georgia Eade early on in 2021. I was about to say last year, but we're 2 years on now. And yeah, that was just such a good training, and just such a nice way to connect with other clinicians from other countries who obviously have a similar interest, and also to hear Georgia's personal experience about the success she's had in her practice using ketogenic diets. And I honestly can't remember where, at what point I realized that diet could have a huge impact on somebody's mental health. So I think before I trained with Georgia, I had wanted to do a deep dive into all of the evidence, and then her course came up, and it was a perfect opportunity to network and learn from somebody who had been using metabolic approaches to treat mental disorder for quite a number of years. So yeah, I can't tell you exactly where the interest came from, but it's definitely been there a long time. And I've always had an interest in nutrition and lifestyle factors, and actually more natural health type approaches, holistic health approaches, as opposed to pharmaceutical.
Yeah. So what was that kind of evolution like? Always being interested in nutrition? Like, did you have a hunch very early on that nutrition was connected, and maybe you just didn't exactly know how? Or, had you ever looked at things like vegan diets or vegetarian diets or anything like that as it related to mental health in particular?
I think it's more in the last probably 5 years or so that I developed more of an interest. And my interest in nutrition has been more from my own personal kind of health issues. So I identify as a sugar addict, and it took me many years to really kind of bottom that issue out and become fully aware of the extent of that in my life. And so a lot of the nutritional interest I've had has just been from my own kind of struggles over the years with the nutritional side of things, and then also some family and friends who've noticed clear health benefits by changing their lifestyles as well.
Yeah. Wow. Okay. So what things did you learn in this course that were different than what you had been trained in?
Oh, I was about to say all of it. So I mean, it was really nice. So Georgia teaches about a modern psychiatric evaluation, and it's like a standard psychiatric evaluation, but including a detailed kind of nutritional diet history, and doing some other kind of blood testing that we wouldn't do as standard in kind of Western psychiatric practice, like particularly paying attention to signs of insulin resistance and those types of issues. So it was just really nice to hear somebody eloquently describe an integrated approach that included nutritional and metabolic strategies to assessing a psychiatric patient. And then it was really nice to hear from her about her successes, but also a summary of all the evidence in terms of the case studies that are out there, and some quite old case studies that I hadn't been aware of. So just aspects of the research literature. So that kind of sparked my interest again in terms of looking more into the research literature as well.
Yeah, and you mentioned research that is even very old. Were you surprised that there was as much research on mental disorders being metabolic in nature as there was?
Yes, definitely. I was surprised that there just wasn't any sort of common awareness about some of the case studies that are out there. I think, unfortunately, what we're lacking are what's felt to be the gold standard in evidence-based medicine, which is randomized controlled trials. However, there are trials ongoing in quite, several countries just now, and I've been lucky to be involved in a local trial that's been happening in Edinburgh, looking at the ketogenic diet in bipolar disorder. So there's a pilot study we just recently finished here, and there are plans to roll out further research. So I think it's going to be an exciting few years for the field of metabolic psychiatry. I have a real personal frustration that I know, and I'm in touch with, I couldn't even tell you how many people, but lots and lots of people who have really revolutionized their mental health, and some of whom have recovered after decades of severe mental illness, and where other treatment modalities had failed consistently for them, and yet making a lifestyle change, and particularly a dietary change, is what has brought their health back to them. And there's just so much information out there, particularly on podcasts. So one of the researchers that I work with in Edinburgh, I've been working with him for a while, and I hadn't realized he had a podcast with an American colleague. And they both have bipolar disorder, and they both interview people, lots of different people with bipolar disorder, who have really gotten their lives back by using a ketogenic diet, you know, whether they've tried other mainstream medications or not. And yeah, it's just a real source of frustration for me that there's not more awareness of that within mainstream psychiatric practice.